Hello everyone, thank you for joining us with the class for the HeroHug and the RotaHugger. My name is Maria Teresa Ferrer. I am a doctor in physical therapy, certified clinical instructor, certified neurodevelopmental treatment therapist, and traumatic brain injury. This is the disclaimer that you all need to know. This class is for general education purposes. Only demonstrates how I personally use the HeroHug and the RotaHugger. It's a therapist design tool. We created this tool to support movement and alignment to perform different activities. This is not a medical device or clinical device, and this information presented is not a universal protocol. It's only recommendation for that is coming from me, the way that I use it. Parents and caregivers should consult with qualified healthcare professionals before using this tool. Licensed professionals should use this to their discretion, to their professional judgment, and apply these techniques just to decide which kind of alignment they are looking for and which one will be the best tool for them. When we created these tools, what we were looking for? We were looking for alignment. Alignment using the rotation strap or the RotaHugger, the binder, for activation and function. It's just a clinical approach. It's only a therapeutic tool that I use during my practice, but everyone can use it, and I have some families and therapists sending me videos how they use it and the success they are having with these tools. What is the problem that we see every day? We see children, like you see in this picture, with difficulty with sitting, head control, and when you are trying to sit down, you have to do a lot of effort to control the movements, and it's very fatiguing, not only for you, also for the child, because they are consuming a lot of energy. So what we create is a tool that if we transition that to stand, it's not going to happen the same as it's happening in here, that the child is crossing the legs. It's going to be even more effort for the child to move and even for you. So it's basically trying to control the challenges. There are the 3 challenges that I face every single day in my practice. As you can see in this other picture, the child has a severe plantar grasp reflex, and those primitive reflexes are also interfering with our work. So the 3 challenges that we see are, number 1, poor alignment. Postural collapses, as we see in those pictures. It affects the entire movement system. It creates a lot of compensatory movements that we cannot fix with something rigid or assisted device, because those compensatory movements get stronger. So low muscle activation. If we do not help the child to activate those muscles, the compensatory movements are going to be stronger. They are not going to be proper alignment. We are going to have other problems like scoliosis, shoulder subluxation, dislocation, hip subluxation, dislocation. So we need to engage all those muscles to create these activations in order for the child to develop better milestones. Then number 3 is limited functional mobility. When you have a child that has no alignment, no activation, poor muscle control, they are going to have limited functional movement. So the compensatory patterns are going to be so many that you have to deal with those in the practice. For example, in this video, we see a child that is having difficulty lifting the head even with the target because it's not pushing from the arms, needs more support, more control. In the other picture, we see a child that is assisted to stand. Is this child going to be successful with these legs that are crossed? No. It's going to have a risk of hip subluxation or dislocation, which is even worse. So what's the shift that we need to do? We all learn how to do stretches, and we teach the parents how to do stretches. Nothing wrong with that. But stretches is not engaging with muscle activation. There is no movement organization. There is no functional carryover. We need to control a lot of fascia to be able to elongate, and those can be combined with functional movement. By simply holding and stretching, we are not going to have enough carryover for the child to be more independent. Then what we see when we are using the appropriate tools to create active movement, we can have the child engaging in sitting. We create conditions where the child can move and be more organized. The nervous system start emerging, they get excited, they start talking more, they can participate with the environment with less effort. I'm not saying that's going to correct everything, because everything has to be in combination with therapy. So the nervous system is engaging and the functional patterns begin, but everything is in combination of movement and therapy. So what's the principle that we use to create these tools? The clinical decision for us to make these tools were following a chain. If we have alignment, we can activate the muscle. And if we can activate the muscle, we can create the function. When we improve the alignment, we have the foundation for muscle activation. When we use this HeroHug, it's not rigid. The child can have it, and it's like pretending that someone is lifting the child from the armpit, and then they feel like they are being lifted, and they engage with more activities. They engage those muscles because this is never preventing from them to use their core. It helps me also with children that when they are standing, they are toe walkers, and they stand like this. I'm getting into the camera, like leaning forward. And when you say put the heels down, and when the heels are up, they go immediately straight with the toe walking. When I do this, they don't bend as much because they feel the HeroHug in here, and they feel like being supported, and then they start lowering the heels even more. And with the alignment that we provide with the legs, they feel safer. So those three elements, alignment, activation, and function, those are the tools that we create with those two things for the sequencing of the movement that we need. So look at this picture. We have a child that has difficulty controlling the position of the legs. What is happening? If you are having difficulty controlling the position of the legs, you can even try yourself, like putting your knees together to see what muscles are you engaging. So the trunk is not in alignment, and then you cannot organize the movement of the spine because you are already twisted. You have no core activation. What we do a rotational control. And as you see, once we apply the RotaHugger, then the trunk is in a better position, the pelvis is in a better position, so we can assist the child with better movement to succeed with more balance and participation in activities. When we have the RotaHugger in action and we train the child to strengthen those muscles, we can actually start facilitating the movements from squatting to pull to stand, because they don't use the compensation, and they don't use movements that are killing their energy, and they start activating the glutes, activating the core, activating everything in their body when they are in a better position. Once we remove the RotaHugger and the HeroHug, the carryover is longer. However, we have to do lots of repetitions and activities to continue helping with the process. When we do rolling, same thing. Sometimes the child, when they move one leg, the entire body moves, or when they rotate the head, they have the reflexes, the ATNR, and the entire body moves. So we have to help with those movements that sometimes by separating and inhibiting the muscles with those tools, it helps us. And then they can engage better when they are playing in the floor. They can facilitate the movements better. And so what we do with the HeroHug is actually with babies, with use for head control when they are struggling lifting the head, when they are learning to do transitional movements, floor to sit, and they are not lifting the head. We help with this. We also create shoulder stability for the child to be able to feel lifted and start reaching with hands, midline orientation of the head, using the arm. We use it also for CIMT when we hide one arm inside and the other one is free, because sometimes the children are experts in taking their hand out. So it's an easy tool to use during those treatments. So when we have the HeroHug in action, we can actually do functional reaching, both extremities, one extremities. During walking, we also do weight bearing, pushing with the arm, and we have active movement during the walking. The difference for this tool and the rigid assisted device for me is that the rigid assisted device is constraining the movement. So it's limiting the movement, it's limiting the muscle activation. I will use the assisted device, I will use the braces, I will use any device that is needed after I see that is absolutely necessary, but before I have to engage the child with active movement and providing the therapy, strengthening and keeping better alignment before I say, yes, I absolutely need the braces or I need something else. But I won't use it until I try something else. And as I mentioned before, those tools are not going to correct any problem that we see. It's going to assist you as a tool to do your job. I am going to show you in this video how this child can engage with the head in midline, because you're going to see the video also how it was before, and actually we posted in social media. And so when she is in the midline and we have the HeroHug, she can actually engage more with the head, has less difficulty, and we assist with the arm. Even in standing, we can control better her foot position. And with the HeroHug, I don't have to deal with her body falling to the side, either left or right side, or full extension to the back. And I use the Velcro of the HeroHug in the areas that I need the most support, because the HeroHug can be double. So we have the HeroHug, and if we need more support on the left side, I pull the Velcro towards the left side, so it's double on the left side. If I need more support in front, I put the Velcro in front, so it's double support in front, or on the right side or in the back. Just depends. I just support the alignment without blocking the movement, because this is not going to prevent the child from using the muscle. It's going to facilitate the activation without the compensation, and it's going to guide the movement, reducing the effort that the child is doing, even the effort that I will do to control. So basically, it's just a tool. It's not an equipment that you need to work. When we use the HeroHug and the RotaHugger, as I mentioned before, it's just alignment to create conditions for active movement. And activation creates the condition for function. So alignment, activation, and function. Those are the three elements that we use as our clinical approach. So here is the sequence of the video that I was mentioning. We have the child laying on the table and is always using the ATNR, and I keep trying, I'm at the bottom of her feet, keep trying to make her to look at me, talking to her, look at me, and she's not even trying. And when she moves, she is struggling with the movement of the head, because the head and the body are going in the same direction. So the legs are crossing, the legs are together, and the arms and everything moves in a block. So once I used the HeroHug and the RotaHugger, I was in the same place in the table, and finally she was able to use the head in the midline, get in the center, just by using those two tools. And I was like, okay, now let's see what happened when she sits. And that's the video that you saw before when she's sitting. And here is a short video of how I use the RotaHugger above the knee and below the knee. If you are using the RotaHugger above the knee, I will advise to get the 2 meters. If you need alignment going all the way lower, use the 3 meters. If you need to block the knee hyperextension and the child is younger than 4 years of age, you can use the 2 meters. The 3 meters I use it for older children.
Here is a quick instruction on how
to use the RotaHugger. I'm going to show above and below the knee. Make sure you have the 2 ends equally. Position the legs as it's shown in the video, in a frog position,
and wrap around the leg.
In this case, I'm going below the knee. And when I go to the end, I put the silicone in contact with the silicone, and that's it. When you are pulling the other side, be sure the inguinal area is completely tight. The other part of the leg has to be firm. In this side of the leg, I'm going above the knee. I wrap the same, and I put the silicone inside in contact with the silicone. So as you saw there, you don't need Velcro. You just wrap and go with the silicone from top to bottom. And usually it doesn't slide, but during my practice, I put it tight only in the inguinal area. The other area is firm because I want this to fall. I want this to come out so the child won't be 100% dependent on this tool. And in this other video, it's the child that you saw previously, and then I'm using just for the entire leg. So I go from the inguinal area and it's tight, then the other part I go firm. The silicone is the one that goes in contact with the clothing or with the skin, and I go all the way down until I get to the area that I need. If I need to cross behind the knee, I will do it, and the video is posted also in my social media. I put the silicone in contact with the silicone, and I go to the other side and I do the same. If the left side is worse than the right, I will put the left side first, and then I will pull stronger on the right side at the inguinal area to rotate a little bit more of the pelvis, which is the case that I have on this child that is always looking towards the left side. And then when I pull, look, she comes towards the right. And then in this position, I can start working to see if she comes to the midline, which I finally did it when I separate the legs and I use also the HeroHug, and look at the active kicking. Okay, this child is the one that you saw in the previous picture that was in crawling position, not pushing from the arms. The legs were together and has difficulty with crossing the legs. We use the HeroHug and the RotaHugger to assist with the sitting position and head control. In this position, for the child that was not sitting independently, not able to balance, we initiate this activity and controlling only from the pelvic area with my hands and trying to see if he uses the protective reflexes. And you know, protective reflexes, once we use those, it's going to stay forever. So the goal in here is that the child, when he's sitting independently, that the mom can go out to the kitchen or grab something or get for a toy, and the child, if he is falling, that he can put the hands and support himself. And also the HeroHug is helping us in this case for the child to come all the way up with less effort. And as you can see, we have the Velcro closer mostly in front and towards the left side because it's the side that he has the tendency to go. And you can see how he's using the hands and the head elevation, hands for head control, hands for protective reflexes, head for control, because it's mimicking that we are lifting him right from the armpit, and so the child can engage. Your mom has also her this child's social media, which is fantastic, like his progress and everything he's doing now, biking. And in here, this child has no condition, and there is nothing wrong with this kid, but I'm going to show you how I apply the upper extremity RotaHugger for supination. I start on the ulnar side, that is from the pinky area, and I roll all the way up until I get to the shoulder. Once I am at the shoulder, I close the silicone with the silicone. You can also go behind the back and cross over as I show you in some of the videos that are posted in social media. And in this position, the goal is to position the thumb up for the child to start playing with both hands, because normally when they have damage in one side of the body, the hand has the tendency to go in pronation or backwards. And in this position, the child can actually keep the thumb up consistently, as you see, and the other one can go down. As you can see, it helps actually to control better movement when we are working with children that have conditions that affect the upper extremity. And for the HeroHug, I normally use it with children when they are little. They are learning to sit or to stand. In this case, I'm actually showing how I use it. The child has no condition, but it's basically preventing that we are hugging him. That's why we call it HeroHug. All of us are working with heroes, and we're just giving them a hug, and they have better posture, better balance. He's learning to walk, and he actually feels like he was extremely strong with this tool. And as I mentioned before, you use the Velcro on the side that is the most affected. Okay, and the next one is actually showing how to use the RotaHugger for positional, the expansion of the chest, the pec muscles, for the child to get better posture, especially when they have severe posterior pelvic tilt and you need to work with them in sitting. So you start from behind and you go with the two straps from the shoulders, pulling in front, and you make an X in the back. You go in front, and once in this position, you can use the rest of the straps for whatever purpose you need. Use your clinical judgment to see how you need it. In this case, we have a very long RotaHugger, 2 meters RotaHugger, and then it can control the movement that we need for the child and keep it in better position. And in the next slide, you are going to see a child that is going to have unilateral holding of the lower extremity. So the lower extremity on the left side is going to have external rotation, and the other extremity is having nothing. So you wrap around the waist and you go as long as you need for the extremity, either above or below the knee, depending on the needs that you have to use the RotaHugger. In this case, I'm using the 2 meters RotaHugger. And here is another way to do it. I'm using the 3 meters RotaHugger, and I'm going to show you how I use it to prevent from drop foot, and also to keep one leg in internal rotation or neutral, which normally I won't go to internal rotation, I will go to neutral, and one leg into external rotation. So I put the RotaHugger at the sole of his foot, and then once I have the two ends, I'm gonna start making X, crossing, and once I go to the side of the knee, I bend it and I cross behind the knee. In this case, the child is not using the hamstring, that's severe hyperextension, and I cross again below the kneecap, and I go all the way up, activating all those muscles to see if the child start doing more knee bending and lifting the foot. And then I will go to the area of the inguinal part, and I will use one of the ends to pull the leg out and to wrap around the waist, and that's the best way to create a little bit more dorsiflexion. And you can actually do that to continue all the way down with the other side to correct one side for toe walking, that maybe sometimes they use only one side, and the other side for nothing or external rotation. And here is how I do neutral in one side. I will go front. I won't use the sticker behind. Why? Because I need the leg to get blocked into neutral alignment. When I come from behind, I'm actually positioning the leg out, as you will see in this other one. Coming from behind, I can actually rotate the leg completely out, which is what I'm doing in here instead of rolling immediately in front. And you will see how I keep one leg in neutral and one leg into external rotation. So when I mentioned that I'm coming from behind, is because I roll the strap on behind, and you can see here one leg is out and the other leg, one leg is the shoes pointing out and the other leg is completely in neutral position, it's straight. That's another way to do it. But if you have doubts on how to position the leg and how to assist the child with this technique, you easily will find me. And here are some of the links that I have on Instagram on how to use the RotaHugger and the HeroHug for you to use it. And just to let you know, we do not answer messages via social media. We answer messages via email. You can go to ferrerpediatrics.com and click in the form Contact Us. Drop us your question. We answer emails first thing in the morning and in the evening, and we are here to help.